Macmillan Audio presents Total Recovery by Dr. Gary Kaplan, D.O. with Donna Beach. Read for you by Peter Berkrot.
Introduction. Thinking about zebras. What had to happen first. Albert Einstein once said, 100 times every day I remind myself that my inner and outer life are based on the labors of other men, and that I must exert myself in order to give in the same measure as I have received and am still receiving. My job is to think about zebras. In medical school, they used to tell us, when you hear hoofbeats, think about horses, not zebras. It's a version of Occam's razor. The simplest answer is the best, and it's good advice. Swollen lymph nodes and a high fever might be Kawasaki's disease, but it's far more likely to be a strep infection. By the time I see most of my patients, the simplest answers have already been explored. They've already been tested by 8 to 15 specialists from Johns Hopkins, the Mayo Clinic, and other excellent medical centers. If it were a horse, they would have found it. The patients I see are mysteries. A healthy, athletic 14-year-old boy who plunges into years of excruciating pain after an anterior cruciate ligament tear and a flood in the basement. A high-powered consultant for international conglomerates who suddenly finds herself standing in a conference room with 15 executives, a migraine, and no idea how she got there. My strategy has always been to treat the whole person, not the symptoms. But as a medical scientist, I was convinced that when patients in chronic pain had a history of emotional, physical, and infectious assaults, all of those assaults must somehow be working together. They were all happening within the ecosystem of the body. There had to be a single point of origin that connected them all. The question plagued me. What was the underlying mechanism? In the end, I found it. This book tells the story of the clues that led up to that discovery, the eureka moment, when I suddenly understood what we've been missing, and the aftermath where I confirmed in patient after patient that all of their apparently unrelated symptoms actually had a single neurological basis. It all came back to Occam's razor after all. Steve Jobs once said that people who come up with groundbreaking ideas often feel reluctant to take any credit for them. They just saw something, he said. It seemed obvious to them after a while. Their insights are based on their ability to see a connection based on the experiences they've had. I feel exactly the same way. All of my education, my patients, my mentors, every experience I've had in medicine and in my own family had to happen first, or I would never have seen this connection. Placebo at best. In the 1970s, a lot of people were starting to realize that, as impressive as it was, conventional medicine did not have all the answers. Alternative practitioners of every ilk were springing up around the country. People were going to health food stores for vitamin supplements and organic food and getting treatments from chiropractors and acupuncturists, despite the fact that their medical doctors were telling them it was pointless. From a conventional medical perspective, alternative medical treatments were quackery at worst, placebo at best. Little distinction was made between acupuncture, chiropractic, homeopathy, herbal prescriptions, magnetic therapy, aura cleansing, and faith healing. At the end of World War II, physical therapy carved out a tentative place on the fringes of respectable medicine. But it would be decades before doctors would stop associating massage therapy with hookers and happy endings. Then, when Richard Nixon went to China in 1971, an amazing thing happened. A New York Times correspondent covering President Nixon's historic visit had an emergency appendectomy. James Reston was rushed to the Chinese anti-imperialist hospital. At first, his treatment was similar to our practices in the West. Doctors gave him a standard injection of xylocaine and benzocaine to anesthetize the area, though Reston was surprised to be kept awake for the whole surgery. A few nights later, when he complained of pain, things began to seem foreign. Li Changyuan, a doctor of acupuncture at the hospital, was sent to treat him. Reston was slightly reluctant, but decided to consider it an experiment.
Sample complete. Ready to continue?